diseases, kidney stones being one of them. People with metabolic syndrome are about twice as likely to have kidney stones as people without. And in terms of people being overweight and obese, they lead to emptying more chemicals into their urine than people who are not overweight. And we'll talk a little bit more about how that leads to kidney stones. Cost-wise, this is a very expensive disease. There's about $2.1 billion spent each year on treating kidney stones. And the breakdown is here. So why does this happen? So in order to understand kidney stones, you have to understand urine itself. In order to understand urine, you have to understand chemistry. And in order to understand chemistry, I'm going to have you understand Kool Aid. All right? So Kool Aid. When you're making Kool Aid, there is a limit to how much sugar you can dissolve into the water. In this case, when we talk about chemistry, sugar is going to be something called a solute. Water is going to be something called a solvent. And on my slides, whenever there's something dealing with solute, that's going to be in purple. Any solvent is going to be in blue. So solute is the salt or the crystal or whatever gets dissolved into usually the fluid, which is water. So at a certain point when you're making Kool Aid, there's no more sugar that can dissolve into that water. And it starts to collect at the bottom. When that happens, you call the solution or the Kool Aid drink itself super saturated. So when you think about something being saturated, that means that it has as much in it as it can hold. When something is super saturated, that means it cannot possibly hold any more of that solute. So there's three types of solutions. There's unsaturated, which means that it can hold more solute. There's saturated, which means it's at the perfect amount. So in Kool Aid, it's the perfect amount of sugar for the amount of water. And then there's super saturated, where there's too much sugar. And I know when I was making Kool Aid, I like to hear that sugar scrape at the bottom of the pitcher, and that's when I know I had enough. So I always had the super saturated Kool Aid. So again, whenever you see solute, that's usually going to be sugar. In this situation, solvent is going to be water, and the solution itself is going to be Kool Aid. So everybody understand that so far? Anybody have any questions? All right. So, and we're going to do a quiz. So which one of these is a solute, which one is a solvent, and which one is a solution? Sugar is going to be a solute. It's going to be the thing that you dissolve into the fluid. So one way to think it, solute has a U in it, and sugar has a U in it. So which one is going to be the solution? The Kool Aid, that's right. The Kool Aid has both. The solution is made up of the solute plus the solvent. So when you add those two together, you get your solution. So your solvent is your water, your solute is your sugar, your solution is the Kool Aid. All right? So if you have Kool Aid made by an unsupervised 11-year-old kid with unlimited access to sugar, is that Kool Aid going to be unsaturated, saturated, or super saturated? That's right, super saturated. So the reason why all of that is important, the reason why we had to go through all that is for something called crystallization. So when you have a super saturated solution and you continue to add more solute, you continue to add more sugar to that Kool Aid, even though it can't hold any more sugar, you get something called crystallization. And that is basically what kidney stones are. Kidney stones are the crystallization of the solutes that are in your body. So as you can see, this is not something that looks very fun for you to pass. It's very sharp, it's very painful. So kidney stones are basically like the sugar at the bottom of that supersaturated Kool Aid pitcher. So, and in the body, instead of it, when it's in the pitcher, it's just a bunch of, sugar all evenly spread out. But when it's in the body, they clump together and forms these stones. So it's like a Kool Aid situation. And the kidneys, the way God designed it, the kidneys are basically the garbage men of the body. So they have their blood flow here. I don't know if you can see this mouse or not. But in that picture to the right, that red and blue tube, that's your blood vessels. That's your artery and your vein. And they take the blood and they send it to the kidneys. The kidneys then look at all the blood and they pull out the solutes. They pull out the things that your body doesn't need, anything that's extra. They pull it out and they dump it into the urine. Then from the urine, you pee it out into the toilet. And that's how your body rids itself of things that you no longer need. So they take out all the solutes and they put it into the urine. Some of the solutes in your body are things like extra calcium, things like oxalate, things like uric acid, things like phosphorus. You don't need to worry about those specific names, but just know that unlike Kool Aid where there's one solute, unlike Kool Aid where there's one solute, the body has many different solutes, many different things that they want to pull out and put into the urine. And all these things can interact in different ways. So urine is supposed to be an unsaturated solution. The way God designed it, he wanted it so that there was so much water that when he pulls things out of the blood into the urine, it's not super saturated. So there's plenty of space for those chemicals to float around freely by themselves. So again, with the urine, you have the solution. The solvent is water, and there are many different types of solutes, many different types of chemicals. Kidney stones happen when your urine is supersaturated. So when you don't have enough water, or when you have too many solutes, then your urine is supersaturated. So when those solutes, when those chemicals are they're around so much, they can actually bind to each other and form those kidney stones. And different chemicals bind to each other and form different types of kidney stones. So you see in this picture in the upper right, what you want is the circle all the way to the left, where you have each individual chemical by itself. Those can easily pass out of the body, no problem. But as you get more and more of them, or as you get less and less water, they start to clump together and they form those crystals. Those crystals become stones. Everybody with me so far? All right. So there's a couple of different things that can cause your urine to be supersaturated. The details aren't super important, but the things that and we'll talk more about this later, but things that you can do to help your urine not become supersaturated are things like decreasing your meat intake, increasing the amount of water you drink, making sure if you have diabetes, that your diabetes is well controlled. And so if you have to check your blood sugar, making sure your blood sugar range is where it's supposed to be. Fruits and vegetables help. And then there are some medications that can affect your risk of kidney stones. So the easiest way to take a solution that is supersaturated and turn it into unsaturated is to add water. So when you have that Kool Aid that's got way too much sugar in it, and you can't drink it, it's clearly made for kids. Like, you add water to it, you dilute it, you make it more dilute, and then it becomes a saturated or an unsaturated solution. So adding more water makes it easier for those molecules in your urine to stay far apart from each other. They stay far apart, they don't join together, they don't become a kidney stone. Unfortunately, if you already have a kidney stone, and some people have kidney stones in their kidney right now and they don't know it because it's not causing them a problem, drinking more water won't get rid of that kidney stone, but it will help that kidney stone not grow bigger. So once you have a kidney stone, most times you're stuck with that kidney stone, but kidney stones can always grow bigger and bigger as more molecules get closer and closer to it and attached to it. And we'll talk about what to do if we already have a kidney stone in a little bit. So, and then down here, we'll talk a little bit more about this later, but the color of your urine can sometimes be a clue as to whether your urine is unsaturated, saturated, or supersaturated. So if your urine is very clear, like water, or very, very light yellow, that's usually a very good sign. That means that your body has enough water that it doesn't need to hold on to more water. It can let some of that water out so that your urine is unsaturated. If your urine is very, very dark, very, very golden, or even a little bit of red or blood tinge to it, that means that your body is very dehydrated and that your body is basically holding on to that water for other reasons and making your urine super saturated. And so that's a major sign that you need to be drinking more water. So why are stones such a big problem? So as we talked about a little bit earlier, kidney stones are very, very painful. Not everyone experiences pain, but most people do. And the thing that can cause the pain is basically when the kidney stone, which is up here in the kidney, comes down through this thin tube. This tube is called a ureter. And it's very easy for that stone to get stuck in that ureter, either in the middle or towards the bottom as it gets into the bladder. If it makes it into the bladder, you're usually home free because from the bladder to the outside, that tube is bigger, so you're usually okay. But that process of that stone going from the kidney down to the bladder is a major reason why people come to see me in the hospital. And again, it has been compared directly to childbirth. The other major issue is infection. So when these stones form, it's very easy for bacteria to get inside these stones and live and grow. So later on, when I talk about the surgeries that I need to do for some of these stones, sometimes those surgeries allow the bacteria that was hiding in the stone to be released into the body. So that's another major problem for kidney stones, is they often have infection within the stone. And that there are times where that infection can get so bad that it actually leads people to be in the ICU, in the intensive care unit, and people have passed away from kidney stones or from the infection from kidney stones. So how do I know if I have a kidney stone? So usually patients have a lot of pain. They have the pain, they come into the emergency room. In the emergency room, they get a CAT scan or an ultrasound, and it shows the kidney stone. Some people will see blood in their urine because as that stone is passing down that tube, it's scraping all the way down. That's going to cause some bleeding. Those are usually the two major reasons. Other times, people are getting a CAT scan for some other reason, and they find out that they have a stone. So if I go back, when the stone is up here in the kidney, down, like not causing a blockage, it is not as painful. Sometimes people have pain from that, but a lot of people will have those stones sitting in the kidney, just growing, not causing any problems. And it's not until that stone, for some reason, gets moved into that tube where patients have the problem. So if you get a CAT scan for some other reason, they may say, oh, by the way, we see some kidney stones in your kidney. And that's something you can come and see me for sure, but you don't have to come through the emergency room. It's not an emergency at that point. So how do we take care of these kidney stones? So there are 4 ways to deal with a kidney stone. The first way is called medical expulsive therapy, which basically means you pass it on your own. There are a lot of people who pass kidney stones on their own. A lot of it has to do with how big your individual tube is compared to how big the kidney stone is. So if you have a very big kidney stone, you're not going to pass that on your own. If you have a very small kidney stone, but you have an even smaller ureter, you're not going to be able to pass that kidney stone. But if you have the right ratio, you may be able to pass the kidney stone and not need to undergo a surgery. There are some medications that we can use to open up that ureter a little bit, kind of help you pass it. Drinking more water and kind of pushing that stone down obviously will help you pass it. And the major thing is just time. So on average, it takes about 4 weeks to pass one completely. Some people pass it a lot faster, some people pass it slower. But after about 4 weeks, if you still haven't passed it and you come back and say, I'm still having this pain, then I start talking about, well, maybe we need to go do a surgery and go get that kidney stone. And again, as far as size, when you have stones underneath 5 millimeters, which is about half of a fingernail, those stones have a much better chance of passing than stones that are over 1 centimeter. Second way to take care of a kidney stone is something called extracorporeal shockwave lithotripsy. All these, just a side note, when you go see your doctor and they say all these really big fancy words and it seems like they're talking in a different language, they are. All these words are from Latin, so you're not supposed to really understand these things. Make sure you do not leave your doctor's office until he has explained everything to you in words that you understand. So if he throws a bunch of big words at you, don't leave there just swimming in a bunch of vocab. You sit there and you say, what does that mean? What do I do from here? There's printouts that they can give you. If your English is not your first language, you can call somebody or they can call an interpreter, but just make sure that you don't leave not understanding what is going on in your body. That's a side note. So this treatment, we basically take these shock waves and we shoot shock waves or shoot sound waves directly through your skin into the kidney or into the ureter and use that to break up the stone. So we angle them so that we shoot like a bunch of different shock waves at different angles, but they all meet right where the stone is to break up the stone. So the good thing about this is there's no cuts, nobody has to go into your body. Bad thing is if you have a stone that is 6 millimeters and we break it up into 3 pieces, you would need to pass 3 2-millimeter stones on your own. Sometimes that's not a big problem, sometimes that's a very big problem. Again, it depends on how big your tube is and how big those pieces are. But passing those pieces can be uncomfortable. Having the shock waves go into your body can be a little bit uncomfortable. It kind of feels like you're getting punched lightly in the same spot over and over again for about 20, 30 minutes or so. Again, it's better than if you were passing the stone, a big stone on your own, but it's all about pros and cons, and it's all about what you're willing to undergo. And the chances of you getting another stone in the future is slightly higher if you don't pass all of those pieces. Because if you leave one of those pieces behind, then the new molecules that you make can attach to that smaller piece, grow, now you have another stone in 3 months, 6 months, a year, 3 years. The third way is surgery. It's called ureteroscopy with laser lithotripsy. And the way that works is I take a small camera. We put you to sleep first. Take a small camera and I go into the bladder and then up into that tube, and using instruments, I can break up that stone, or I can take a basket, grab that stone, and pull it out. The good thing about it is I'm directly there. I can see if there's any other smaller stones. I can take care of those. The chances of there being any stones left over afterwards are very low because I go and I look through all the areas to make sure there's nothing left. Bad things is it's a full surgery, so you have to go to sleep. Afterwards, we have to leave this small flexible stent. It's like a straw, and it works kind of like an inside-out bandage because I've gone up and down this small tube, so we need to make sure that heals. And we don't want it to heal and swell up and close. So I leave this small straw to allow it to heal itself without it closing off. Taking out that straw is easier, but it has to be done a little bit later in the clinic. But you don't need a second surgery for that part. The fourth way is for really, really big stones. If you have a stone that's so big that it's taking up almost the entirety of the kidney, I need to basically poke a hole into your back directly into the kidney and take out the stone that way. So that's the biggest surgery. That's for people who had this huge kidney stone for a very long time, and we're basically to the point where that kidney is not doing its job very well because the stone is so big. So I can usually get the whole stone out, but that's a pretty big surgery. And that's something that you would have to stay overnight in the hospital for. The complications involved with that surgery. But at that point, it usually is the only option. Does anybody have any questions about the treatments? Yeah. How long did it take what? So it depends on how much work I had to do while I was in there. Usually for this surgery, where you put to sleep and I go in through the bladder, usually you're able to go back to work in about 3 to 4 days. You come back in about 1 week, I take that, and you're usually back to somewhat normal in about a week. For this bigger surgery, where I had to put a hole in the back, you spend the night in the hospital. Some people have you leave out with a little tube in the back. You come back in about a week. You make sure you're doing well, and it usually takes about a week and a half, maybe 2 weeks before you're ready to go back to work. What other questions? So every adult should be doing everything to prevent the kidney stones. As far as your concern is more so based on your risk factors. So if you know that you're not drinking a lot of water, if you know that you're eating steak every night, if you know that you don't eat any fruits and vegetables, then your risk for a kidney stone is higher than somebody who's not doing those things. If you have pain in the back or blood in the urine, then that's a really good reason to be concerned about kidney stones. But if you're eating healthy, if you're exercising is also another thing that's good for just in general life. If you're eating healthy, you're drinking enough water, exercising the way you can, it's just something to have in the back of your mind, but it's not something that you really need to change all the good things that you're doing. If someone tells you based on a scan that, oh, you have a kidney stone, then you'll come and see me or another urologist, and we'll tell you based on the size of the kidney stone, is there something that we need to do now, or is it something where we just keep an eye on you? Does that make sense? So it's there's no actual number where you go, okay, now I need to worry about kidney stones. It's more so as long as you drink enough water, there's a lot of people who will never have a kidney stone. Or there are people who have a small kidney stone and it will never be a problem for them, and they'll pass away never being bothered by it. So there's not a number where you say, like the way colonoscopy, like once you reach a certain age, you need to have a colonoscopy. There's no number where you can say, once I hit this age, I need to be worried about kidney stones. Most commonly, people at age 60 will, if you're going to have a kidney stone, most commonly you have it around age 60, but I don't want people who are 40 to be like, oh, I don't have anything to worry about. And I don't want people who on their 60th birthday are like, oh my goodness, now I'm gonna get a kidney stone. So it's not that kind of cut and dry. It's just more about you making sure that you drink enough water, making sure you eat enough fruits and vegetables. Does that make sense? A history component where they haven't exactly what the reason why that is. I believe it's the way that it produces the blood, the urine, so it's at a fast rate. So if there are people in the family who have had kidney stones, that's something that you need to be aware of. But often, families who have had kidney stones are also families who all eat the same types of things, who all drink the same amount of water, who all have diabetes. So there's other factors that run in families that can make kidney stones more common, even if the actual kidneys are working correctly. So it's looking at the entire thing, because chances are, if your parents didn't value drinking water, and if your parents didn't value fruits and vegetables, then when you become an adult, you're not really valuing drinking water. And so those things make you more likely to have a kidney stone, separate from your DNA. Yes, sir? Yes, it is possible that you can have stones in both of your kidneys at the same time or both of your ureters at the same time. If you have them in both kidneys, but they're not obstructing or they're not blocking the flow of urine, then it's not an emergency. But if you have a stone blocking both sides, then that's something where I need to take you to the operating room, because the kidneys are very important for life. So if both kidneys are blocked off at the same time, that's an emergency, and that's something where I have to make sure that we unblock those kidneys. Otherwise, it leads to things like dialysis, where both of the kidneys die, and you need to be hooked up to an external machine that does the work of the kidney when the kidneys don't work. It is rare, though. It is rare for you to be so unlucky that you had two stones that formed at the same time that both got blocked at the same time. It does happen. I've seen it, but it's not as common. Other question? Yes, ma'am. Yes, you are. And if you've had a kidney transplant and you have a kidney stone, it is more important for you to be aware of that, because you basically have that. Because you've had the kidney transplant, that means the kidneys that you were born with are not working. So now you have one kidney doing the job of both. And if that kidney gets blocked, it's the same thing as before with both of those kidneys getting blocked. But it's in a kidney that's even more important and usually a little bit weaker than the ones that you're born with. So that's another emergency where I would take you to the operating room right away and make sure that that's blocked. Mm-hmm. Right. It's closer to the bladder. It's just things as far as in the operating room, I just move a little bit differently, but it still has all the same options available to patients with the transplanted kidney that people with other kidneys have. Yeah, go ahead. Sorry, one second. Go ahead. Usually the symptoms are pain. This one. Usually the biggest symptom is pain. So patients usually come to me telling me that they have a kidney stone. They have really intense pain in the back on whichever side that stone is on, and that pain will usually kind of radiate or kind of travel downwards. So sometimes you have pain in the back that travels to the groin, or sometimes even to like the testicles, because the nerves that are attached to those areas are all very close to each other. So the body is a little bit confused. It's just like, I don't know what's happening, but it's intense pain, and I feel it all the way down here. So when you go to the emergency room with that, they usually like, this patient could be having a kidney stone. Let's send him to a CAT scan. Once they do the CAT scan, they're able to look inside and see if they do have a kidney stone. Sorry, I'm gonna go with you first and then. Those are by far the most common. Outside of that is people who have found out accidentally that they have kidney stones from a test for some other reason. But usually when the kidney stones are causing a problem, it shows up as pain, blood in the urine, or infection. That's the other one that if you have like a total body infection, you kind of feel like fevers, chills, nausea, vomiting, things like that, and you go to the emergency room for that, and you have pain, then they're also going to look for a kidney stone. Technically, yes, but it's pretty difficult to drink because as long as you have healthy kidneys and a healthy heart, your kidneys will take all that extra you drink, put it into the urine, unsaturated. So as long as the doctor told you to cut back on your water, usually you're pretty good as far as things could be every other day. Then those kidneys can't take the extra water that you put in and get rid of it. But outside of that, you're usually okay with drinking water. And we'll go over kind of the general amounts of water you need to drink. But the easiest way is usually by looking at your urine afterwards. If it's nice and clear or very light yellow, then that's usually a sign that your body has all the water it needs for everything else and enough to make sure that your urine is balanced. Right. You had another question? Okay. Yes, sir. Probably good. You probably don't need to drink a full gallon unless, yeah, probably. A full gallon of water is usually more than what you need unless you're doing something, like if you're running a marathon or something where you're sweating more than other people or things like that, then you need to replace those fluids. But some people, like, there was a thing going on where it's like everyone needs to drink 8 ounces of cups a day, 8-ounce cups per day. That's a kind of a general number, if everyone did that, almost everyone would be good. But if you drinking 8 cups of water a day is about to get you fired from your job, like, you can cut that back. I don't want you or if you're waking up 3 times at night just to drink water just because you think you're supposed to, that's not necessarily a balanced life. And then there are also some medications that require you to drink a little bit more water. So if anybody has really high blood pressure and they're on something called a water pill, The way the water pill works is it tries to put more water into your urine because your blood pressure is high because you have too much blood. Or because that's not the best way to say it. Your blood pressure is high, and they're trying to decrease your blood pressure by getting rid of some of your blood volume, by turning some of that blood into urine. So for those patients, drinking a ton of water will kind of counteract the goal of the medication. So if anybody's on a water pill, the other name for that is hydrochlorothiazide or HCTZ. Those patients, you want to just drink to the point where your urine is clear, but you don't necessarily need to be doing the full 8 ounces. Easy. Yeah. 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 Yeah, good question. So usually people experience what we call a colicky pain, where it's like gets really intense, backs off a little bit, gets really intense, backs off a little bit. But some people have just the constant pain. Some people have like a shooting pain. So I don't want you to, if you have that kind of pain, regardless, you're on your way to the emergency room. So, and then they can usually take care of it from there. But on average, it's usually an intermittent type of pain. What other questions? Yeah? Mm-hmm. So with juice, it depends on what kind of juice. So fresh squeezed orange juice or lemonade with real lemon juice is actually pretty good for preventing kidney stones. Those sugary juices, like anything with sugar added, usually ends up not being nearly as good as water would be. So if you're going to drink those juices, you need to also try to drink some water to supplement that. Yeah. Yeah, sure. Sure. We're pretty close here. So we talked about the last surgery itself, and then as far as prevention, which is what we've already been touched on. Biggest, most important thing is drinking water. You want to drink enough water. That greatly decreases your chances of getting kidney stones. The study says that you want to drink enough to produce 2 liters or half a gallon of urine. That's kind of difficult to measure. I don't want you sitting there trying to measure the amount of urine you make. So for most people, that 8-ounce glasses is good, or 4 like this is 16. So 4 of these is usually a good number to start with, and then you can increase or decrease from there. But if you're ever in doubt, you want to drink enough water so that your urine is nice and clear. If you already have stones, there's some medications that we can do to try and prevent the chances of you getting another stone. And you just talk to your urologist about that. And then diet. Anything that's good for your heart is also good for your kidneys. Lots of fruits, lots of vegetables, decrease meat, increase water, decrease salt. So the amount of salt that you put in your body is another one of those chemicals that has to be put into the urine afterwards. And when it is put into your urine, it comes with other chemicals that can form a stone. So if you can do a low salt diet, that's going to greatly increase your chances. And I think that's it. What questions? Or how much? Do you have enough time? 2 questions. I'm sorry, say it again. Yeah, so that is something where I do have a couple of patients that say, I have pain in my back that's radiating down, but it's radiating down the leg instead of radiating kind of inward, and that's usually sciatic nerve pain. So that's something where, a doctor kind of has to really talk to you. You have to really talk to your doctor to try and understand what is the cause of that pain. But that is something that we run across a lot. That was a good question. All right, last question. Amen. All right. All right. Yep. All right. Thank you.
Powerful, powerful, powerful. Thank you. This was incredible. I told you, he has a tremendous ability to make it relevant and bring it down to where we can all understand and to change our lifestyle here. We all can get better. No matter what's going on, please drink your water. Very clear, cut back on your meat intake. Here, a lot of vegetables, a lot of fruits just make a big difference. Every inch by inch, we get better, all right? With the body, as we get older, we don't need as much food as when we're younger. Please, I'm telling you, honestly, you don't. When you're younger, you can do it, your kids and grandkids, but as we get older, you're going to be okay. You won't die. So thank you, Doc. This was powerful. Thank you. Technicians, thank you, technicians up top. Thank you. This was good. We can all get better. We're going to leave here determined to change our lifestyle a little bit. It's a habit that we got to break to become better. I want you to be around. I want to see you in Central Park and Prospect Park at 103 walking with me. All right? 103, 107 jogging. Amen. One final time for those on social media, thank you so much for joining us. Have a great afternoon. God be praised. This was brought to you by Bedford Central, the church that's in the community.